Hello, I'm Katie Baca with BSN346, and I'm performing the Deep Tendon Reflexes skills video. I have provided privacy for my patient and performed hand hygiene, and I've positioned her so that I can perform my assessment. And I'm going to introduce myself. Hello, I'm Katie. Can you please tell me your name and date of birth?
Megan Evans, 9.
Thank you. And now I will explain the procedure to the patient. What I'll be doing is using this reflex hammer, and I'm going to be tapping gently on 4 parts of your body. We're going to be checking your bicep tendon, triceps tendon, patellar tendon, and Achilles tendon. And what we're doing is we're checking to see if we elicit a response that we can measure. And it's typically performed on pregnant patients, which tells us possible preeclampsia. Typically, if the patellar tendon were to be tapped and it was hyperactive, along with other signs and symptoms, this could indicate preeclampsia, but it can be performed on anybody. It's testing the motor system function and the condition of the upper and lower neurons. It's scaled on a graded scale 0 to 4, 0 being absent, 1 being diminished or hypoactive, 2 being normal, 3 being hyperactive and brisk, and 4 being hyperactive and brisk with clonus. So to start off, we're going to be I'm only doing it unilaterally, not bilaterally. In the real world, you would do it bilaterally. Just for purposes of this video, we'll do it unilaterally. So to start off, I'm going to do the bicep tendon. So I'm going to have her arm completely relaxed. And I'm going to place my thumb over her tendon. Using the pointed side of my hammer, I'm going to strike my thumb, and this should elicit the response. Good? Good. Next up, I'm going to do the triceps tendon. So we're going to lift the arm, and again, have her completely relaxed. And I'm going to feel just above the elbow bone, about 1 inch. Using the pointed side of my hammer, I'm going to strike it. Good. Next up, we're going to do the patellar tendon, and we want to ensure that her leg is dangling and completely relaxed. We're going to feel for the kneecap and go just a little bit below that with the wide side of the hammer. Good. Next up, we're going to do the Achilles tendon, and again, we're going to want to make sure that her leg is completely relaxed and dangling. The Achilles tendon is at the back of the heel, just above it. And what we're going to do is we're going to dorsiflex her foot, and using the wide side of the hammer, strike the tendon, and she plantar flexed, which is normal response. Lastly, I'm going to check for clonus. So we want to, again, make sure that her leg is dangling and completely relaxed. I'm going to dorsiflex the foot and let go. Dorsiflex the foot and let go. And so her foot has just fallen, and that is a normal response indicating negative clonus. A positive response would be if I dorsiflexed the foot, and as it fell down, it kind of did a little bit of twitching or tremors. That would be a positive clonus. And so lastly, what we're going to do is I'm going to perform hand hygiene, position my patient for safety, and go document my results.